The age in and of itself is not a major factor with joint replacement. I've operated on people as old as into their 90s. People can still get back to doing the things that they love. My name is Dr. Blair Ashley, and I'm one of the orthopedic surgeons who specializes in hip and knee replacements. Patients who come to see me with arthritis are typically people who have been in pain for a long time. They have been struggling and trying to do things on their own, and they're coming to see me to see if surgery is a reasonable choice for them. I like to be very hands-on with my patients. I'm certainly seeing you before surgery as many times as you want or need. I see you immediately after your surgery, talk to your family members. Typically we interface about 2 to 3 times within the first year after a joint replacement. Also, the nurse navigators are a critical part of our joint replacement team. They are an extension of me and the other joint replacement surgeons and facilitate patients getting ready ahead of time before surgery. They also see the patients in the hospital after their surgeries as well. There's a lot of correspondence leading up to the surgery as well as after the surgery. Hip replacements are a very successful surgery. It's something that can be really life-changing for people who have been suffering with arthritis. A lot of times my patients go home the same day after a hip replacement. You're up and walking right away, usually using a walker for a week or two and then transitioning to a cane. And a lot of times when people, once they get it done, they're like, well, why did I wait so long? Knee replacement surgery is a very successful surgery as well. The majority of people are very happy. So that's something where I rely on my therapy colleagues to really help with patients post-operatively to keep them motivated and keep them pushing themselves. And there are really no restrictions post-operatively. You can go back to doing whatever it is that you like to do. Well, I'm a surgeon and I love to operate, but that's not the only thing that I do. I'll be the one giving you your injections. Knee injections are things that I do in the office, either with steroids or with kind of what are referred to as gel shots. And the hip injections are things I have our radiology or pain management colleagues do under image guidance for safety purposes. But those are things that can really help people a lot and sometimes can be a successful form of treatment for months to years. One of the things I love the most about my job is the fact that I can get people back to doing the things that they love. They spend years and years as their pain gets worse, sacrificing the things that they love to do. And the goal with my surgeries is to get them back to doing those things that make their life fulfilling.